professional. Oh, 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 oh. A chat with a professional. With smiles is so good. A chat with a professional. Oh, 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 oh. A chat with a professional. With smiles is so good.
Do you think that Baba Obasanjo could be on the stage while these Boko Haram people are doing what they are doing?
The objective of the private organization is slightly different from...
Nigeria is the most important country
for education. The collapse of culture in Nigeria. Even with cheating, we can't pass.
We've not done enough. There's still more. Join us.
And you'll never regret that you did.
For so long, I've so much talked about what Nigerian professionals and indeed Africans in diaspora can do to contribute towards enthronement of good governance on the continent, as well as improve the living standard of our people. For so long also, I've featured such professionals on my show to talk about these issues. And so today, once again, it's going to be my delight to have someone who has seen it all, someone who has paid his dues, who had his higher education in Nigeria, ran a company in Nigeria before migrating, and for over 2 decades has sojourned in the United States of America, where today he provides home care services in the healthcare sector. I urge you now to sit back as I take on short break, and by the time I return, I will properly be introducing my guest, who actually has been a club president of the Rotary Club, the Bear Creek Copperfield in Houston, Texas, and also sits today as the president of Enugu Provincial Union in Houston. So sit back now, I'll take a short break and I'll be right back. You're still watching the show Chat to the Professional, and like I mentioned, today we are going to be looking at the contribution of our brothers and sisters. When I say brothers and sisters, I'm talking about Africans in the diaspora. We are having this constant review of their activities, what they are doing, where they are, and how they can, as a matter of fact, impact positively on the lives of the people back home. So to discuss the issue today, we are largely going to be focusing on medical services, and that's why I have the pleasure and privilege of the Chief Financial, or rather the Chief Finance Officer for Niche Medical Group, an organization situated in Houston, Texas, the United States of America. So join me now as I welcome to the show Izzy Ojonta. You're welcome.
Thank you, Martin. Thank you for having me today.
Good. Now, for so long, we've had situations where Nigerian professionals living and practicing abroad, all they do is castigate the leadership of, let's say, Nigeria or the entire continent of Africa for not doing enough to uplift the living standard of the people. And what comes to my mind usually is, in as much as we might criticize these leaders, are we as professionals doing enough or contributing our own quota to the development of the continent? You've been in the United States now for over 2 decades, and you operate a health service outlet. And what comes to my mind is, health services in Nigeria as is currently structured, we all know that is practically in shambles. What can we do that we're not doing well?
Thank you, Martin, for having me again. And as it relates to healthcare services, there's a lot that could be done as it relates to health, because one thing I have learned over the years is that people live their health chasing wealth, and when they get wealth, their health goes, and they can never use wealth to buy health. So, and in saying that, that is why I see a lot of our brothers and sisters back home that have acquired the health, that have acquired the wealth, and they will leave our continent going to overseas to try to seek get health services.
Yes.
But at the same time, they can as well, you know, provide those resources back home and be able to make sure that they can take care of themselves while they are home, and also take care of the less privileged back home. So basically, you know, so there are things that could be done, and I think we have people that have the knowledge and also have the wherewith to provide the same health services that we have here back home. We have our own people that are doctors here, and we also have our own people that are doctors back home. It all depends on the people that is managing the affairs of our country and African continent in general.
No, but isn't it ironic that, of course, in the state of Texas where you are, we have a lot of Nigerian health professionals, doctors, nurses, specialists. Isn't it ironic that they excel? They do exceedingly well. We know so very many of them who are renowned in their fields of practice. Yet, back home, we have these issues. Is there any problem with our thinking and our approach to duties at home? Because sometimes, even when you find some of these professionals who practice abroad relocate to Nigeria, you still see a decline in the way and manner they approach their duties. So what do you think is the problem?
I think what I can, since I don't have an outfit there, anything I'm telling you would be a speculation and an assumption, so I can't be telling you for sure.
Yeah.
But just looking at it from the hindsight, I would say that what may happen is they may have the good intention when they start, but when they run into roadblocks about getting access to certain things that will be able to help them deliver the healthcare services, they may have trouble getting that. And in business, you cannot do a business by yourself. You're going to need people to help you run the affairs of your business. And if you don't get the well-trained people, because you cannot bring everybody that is going to help you run your business in Africa or in Nigeria as a country, you cannot bring them and come and train them here. So you have to train them. You have to use the people that is trained back home. And if they are not well-trained, then it's going to be hard for you that is well-trained to be able, as one person, to try to train hundreds of people that you may be working with.
Okay.
So, and at the end of the day, then you may not be able to get the result that you're trying to achieve.
Yes. Okay, now having said that, I'm looking at the kind of services you provide in the United States, home health services, as it were. It's practically non-existent in Nigeria. So everybody would have to get to the hospital and would have to be admitted in the hospital to get adequate Medicare. Even sometimes, or a lot of times, even when you are an inpatient, you are not able to get as much attention as people over here in the United States would using home care or home services. Do you think, or don't you think it's time those of you who are practicing abroad began to look towards domesticating some of the things you do here back home? You know, do you not think it's time we began to do that, or must we wait for the government all the time?
Well, I don't think we have to wait for government all the time. I think it's something that we can be able to do ourselves, because government is me and you and the population at large.
Yes.
It's the government, because if everybody plays their own role, then the government is there to oversee.
Yes.
So, government makes the laws, and then it's left for the masses to obey the laws and be able to carry out their individual businesses and their duties.
Yeah.
The things that we do here, what our company do here is we specialize in home health and home medical equipment, and what that is that we go between the hospital and taking care of the patients at the home. These are individuals, they're not sick enough that they can be able to keep on staying in the hospital, but they are also sick that you cannot leave them at home without someone going there to monitor them. Whether it is going there on a weekly basis, whether it is going there on daily basis, depending on what the case is, but you can be able to care for them at home. Another reason why we have that is because of the way the medical system here is set up, because it is very expensive to leave someone at the hospital overnight. You could be paying in excess of $10,000. But at home, they could be paying a fraction of that to a home health agency, taking care of that patient at home. So that is why what we do comes into play. And that could be duplicated in Nigeria, even though we don't have the same kind of health system, because I also learned that some of in our place now, there are health insurances, and those health insurances do pay for you for health, because what we do is paid by health insurance companies. You can also pay cash for it for those that can afford to do that. And the government can also pay for people that is not able to, don't have health insurance and don't have the fund to pay for it. Government cannot be able to step in to pay. But government is not stepping in to pay. These are individuals who has also contributed into the system. And that is when the government can be able to step up and pay for them, because these are money that have been taken from them when they were working. And now government have invested all this money all these years, and they cannot begin to use it to pay for them, to make sure that they age gracefully.
Yes. Okay. Well, we're going to have to take a short break. Please don't go anywhere. By the time I return, this discussion with Izzy Ojonta will continue. Please stay.
A chat with a professional. Oh, 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 oh. A chat with a professional. When smart is over. A chat with a professional. Oh, 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 oh. A chat with a professional. When smart is over.
Do you think that Baba Obasanjo could be on the stage while these Boko Haram people are doing what they are doing?
The objective of the private organization is slightly different from...
Nigeria is the most important country for education. The collapse of culture in Nigeria. Even with cheating, we can't pass. We've not done enough. There's still more. Join us.
And you never regret that you did.
You're still watching this show, and before we went on break, Izzy, Ojonta and I were talking about how we can domesticate some of the things they do in health care services in the United States, in Nigeria, to ensure quality health care for our people. So before we went on that break, you were talking about the possibility of domesticating, you know, what you do in the United States, in Nigeria, for instance. And what comes to my mind is the issue you raised about health insurance. Yes, we have health insurance scheme in Nigeria, for instance, but the informal sector seems to contribute much more than the formal sector in our country's GDP. And I said this because of the health insurance scheme you talked about. Here is a different scenario, because most people who work or who earn a living, you know, there's a record to show that these people are working. And of course, it's easy to assess and know what kind of insurance they can take. You know, you can easily advise. But back home, that isn't the case. So I am thinking, isn't there a way that those of you who are into home care services in the health sector, who are Nigerians or Africans as it were, can come together, okay, to form, you know, to synergize, to set up something that will be enduring, something that, you know, can run without government intervention apart from regulation as it were. A situation where people could possibly form cooperatives, okay, towards healthcare services. Don't you think you should think in that direction?
Well, I think what we do here could be replicated anywhere in the world, okay, not just in Nigeria or Africa as a continent, but because most of the things we do back home is, if you need a service, you pay for the service. You could do it that way, same way in Nigeria. Okay. If someone is going to need you to care for them at their home, then they pay for the service. You don't have to have government.
How affordable would that be? Because I know that what motivates you. The reason why I'm saying it is, you have a system that encourages you to give the best. Now, if you do pay as you go, as it were, don't you think this service might be outside the reach of the ordinary Nigerian? Because I'm not sure what you're doing here is an elitist thing. That's my concern.
I won't think it will be. Don't forget that. Don't forget that every economy, anything you do, is going to be based on the masses. If you're going to want the masses to be able to afford it, you have to make it affordable for them. People get what they want. Your health is something that you will pay whatever it takes to take care of you. If someone is sick and they tell you this is what you need to do to get well, there's no amount of money. Even if you don't have it, you will go borrow, because you know what? You want to take care of yourself. But in this case, we're talking about having you to maintain live a good quality of life and be able to live, because most of the things that people die from back home are things that is manageable in this country. Our people die of diabetes. Our people die of asthma. They have an asthma attack, and the people that they don't even know what is called an inhaler. Sometimes they may misplace it. Sometimes they may be asking people at home, they don't know what it is. Some people may have diabetes, and our people don't go to the hospitals, and I'll say everybody. Some people don't go for their annual checkup, because that is not the way we were brought up. It wasn't something, it wasn't the system that we grew up in. Most of the things that we do here, because we came here and we witnessed what is going on here, then we start doing it. Yeah. What we do in terms of our people trying to care for themselves, in terms of doing your annual checkup so that you can be able to live with things, because most people back home, in the USA, goes home to do medical mission. Majority of the things they go home with is all diabetes, is diabetic patient, diabetic medications, which is things that is manageable. But the issue we run with such services we do deliver once a year is that it's not enough. But people will accept whatever they could get, because if somebody gives you a medication this December and wait for another 5-10 years to come back to you, before you get there, the person is gone. But it goes down to education, and it goes down to people going into the hospital. But what we do can be able to fill in that gap. But that is affordable. It will be affordable. To answer your question, it will be affordable, because when you do your visibility studies, those are the things that you have to, as a business person, when you're trying to start any business, you have to do your visibility studies. You have to know what is the annual income of the people that you're going to be targeted, because you're going to have a target audience. Then you can be able to make it affordable for them.
You're just hitting the nail on the head now. Because my concern is, are you thinking about it? Have you done something about it? I am concerned about people, Nigerian professionals or African professionals practicing abroad, giving back to the continent, you know, the country of your birth? Because, you know, it worries me when professionals who live abroad are not able to concentrate doing their jobs because they are thinking about how to send money home. So it worries me because I know that apart from providing those services, you are going to also empower people. People will be employed to do this job. People will be trained to do this job. And that's what they talk about, technology transfer. I mean, I don't know, that I am concerned about it, but let's not dwell so much on that. As you were speaking, you mentioned the name of an organization, and that reminds me, in Houston, you are leading the Association of Enugu People, Enugu State, people of Enugu State origin in Nigeria. And what comes to my mind is, as a group, when you meet, how much of empowerment of the people do you talk about? You know, or is it just you come together as a social organization, you marry and you go? There's a reason I'm asking you this, but I'll take you from your answer.
I think we really do talk about empowerment.
Okay.
It is you need to understand that. Let me back up here. In Houston, we have the people are led is called Enugu Provincial Union and Enugu Progressive Union. Okay. We have two Enugu organizations in Houston.
Oh, okay.
So I'm leading one of those organizations. Mm-hmm. Let's be clear, not all, okay, because we have two organizations in Houston.
I see.
Then, when we get together, we talk about empowerment. We talk about how to empower ourselves here, one, and we also talk about how to empower people back home. So you find it that it is not easy on us, because when we're here, we're trying to run two homes. We have to be able to maintain our home here, yeah, and also try to take care of our people back home. So we have two things hitting on two fronts. So it is not an easy thing, because when you're living in this country, we have to be able to work, be able to make sure we measure up. There is a lot of things pulling us here, because you know that we are learning a lot of things because we didn't grow up here. So we have a learning curve that we have to go through to be able to get into that. But in our meetings, we talk about, because now we are here and we're having our own offsprings here, and we have to make sure we let them know where we're from, mm-hmm, so that they don't forget that, hey, look,
they don't lose their identity.
Yes, they don't lose their identity. And those, there are cultures, we have to instill those things that we, as an Enugu man, as a Wawa man in the United States, there are things that makes us who we are. And we want to make sure that our own kids don't lose sight of that, because we're not going to be here forever. And if we do go back home, they may want to come. And if they want to live here, they may live here because they are Americans, and also they are Nigerians as well. So we talk about these things, and trust me, these things keep us up at night. We want to make it here, and we also want to make sure we take care of our people back home. So these are things that we talk about.
Okay, that's fair enough. Easy Ojonta, within the past 20 minutes or thereabout, it's been my delight, you know, having this conversation with you. I am hoping that we'll have a day when all of us can come together in Nigeria to look back and say, yes, we've gone, we've seen, we've conquered, and this is what we have brought back home. So thank you very much for being a part of my show today, and I wish you all the best.
Thank you, Martin. It was nice speaking with you today.
My pleasure.
Thank you.
Please, viewers, don't go anywhere. A chat to the professional returns in a moment. Well, I'm afraid as much time would permit on the show, a chat to the professional today. Come next week, we are going to have another professional come talk to us about an issue either of national importance or something that indeed could uplift the spirit of the young ones to aspire to be who they really want to be. So till next time, I remain Martin Sobu saying stay blessed, and I'll see you again.